What are the subtle warning signs of pancreatic cancer? So, pancreatic cancer is regarded as one of the most aggressive and deadliest types of cancer. It creeps in very, very slowly and very, very silently. Unless you know what the warning signs are, you probably would think that it's just some other kind of health issue, where it's not, and it really needs to be addressed as soon as possible. Usually, it's only identified very late in its growth, and it's normally mistaken for other health issues, so people generally ignore it. But it's probably a good idea to go and check with your doctor if you have any one of these warning signs that I'm going to get into. So, in this video, I want to get into how you can suspect that you may possibly have something going on with pancreatic cancer and how you can prevent this in your life, because pancreatic cancer is becoming more and more prevalent in society today with the toxic food that we're eating and the toxic environment that we live in. So this information is for educational purposes only. I'm not diagnosing you with pancreatic cancer. I'm not telling you that you may have it. I'm just giving you the warning signs so that you can prevent it or you can catch it early so that you can handle it and not leave it too late. So before we get into these warning signs, I want you to just understand what the basic function is of the pancreas and why the warning signs are what they are. Once you understand how the pancreas works, you'll see why these warning signs are warning signs. So the pancreas is located deep within the abdomen, tucked in behind your stomach, mostly on the left-hand side, kind of just below the ribs. It has two major roles. One of them is to produce enzymes to break down fat and other nutrients while you're digesting your food. And the other is to produce insulin so that you can control your glucose levels. So one of the things that one needs to look out for is some kind of a digestive type of issue that you might have, like not digesting your fat properly, or some issue with your stool and it starts to look a little bit different to what it did before, or even things like type 1 diabetes setting on or type 2 diabetes setting on could also be something that one could look out for. But there are another 7 specific signs that you really need to take note of if you have any one of them. Sudden and unexpected weight loss. So this is probably the most visible sign that something's up with the pancreas. So if this has happened to you, go get yourself checked. The reason for this is because the delivery of digestive enzymes isn't at the rate that it should be. So you're not digesting your food and you're not extracting the nutrients from the food that you're eating. So you just continuously lose weight. It can also affect your appetite. So you just don't feel like eating. And when you do eat, you can't have a large meal. You can't eat a lot. You get full very, very quickly. So the combination of poor digestion and lack of appetite is definitely one of the warning signs that something's up with the pancreas. This is not the same as deliberately losing weight. This is something that happens when you're not trying to lose weight, and it will just continue to lose and lose and lose until you're basically just a bag of bones. Another sign is a dull and consistent ache or pain in that area, in the abdomen, deep in the abdomen. So it normally starts around the belly button area and then goes backwards towards your spine. Because the pancreas is deep within the abdomen, it's very difficult to pinpoint exactly where it is. It's just this constant dull pain that you have in your abdomen that you can't really explain. This ache or pain can actually become worse after eating. So if you've got an ache in your abdomen, it doesn't automatically mean there's something wrong with your pancreas, some random ache that you've just gotten. This is something that's persistent. It's persistent and it gets worse when you eat. So if you look out for that, you may need to go to your doctor and have your pancreas checked. Number 3 is you start to get jaundice. So your eyes start to yellow and your skin may even start to yellow and even itch. Your urine becomes unusually dark and like kind of a rust color. This is caused because the tumor can actually obstruct the common bile duct. So your bile starts to back up into your system. It's something called bilirubin. And it'll make your eyes go yellow and it'll make your skin go yellow. And depending on the location of the tumor, the jaundice may or may not happen. So if you find that happening to you, take some Tadka on an empty stomach between meals and see if that alleviates it. It may just be a blockage because of a sticky gallbladder or gallstones or something completely different to the pancreas. But nevertheless, jaundice that just comes out of nowhere is definitely a sign that needs to be taken note of. Another thing you need to look out for, which is the 4th sign of pancreatic cancer, is consistent diarrhea. So basically then your pancreas is not creating the enzymes needed, or there's a blockage in that duct that's pushing those enzymes into the small intestine to break down nutrients and fats specifically. So then lots of undigested, oily type food or fatty type food goes straight through and it starts to keep the bowel very, very, very loose, which causes chronic diarrhea. That can also cause major problems in itself and is one of the reasons that people have the massive weight loss. Number 5 is suddenly you've developed diabetes type 2 and even diabetes type 1. So with diabetes type 1, you have the pancreas, which is no longer creating insulin. Diabetes type 2 is that the pancreas is not helping to regulate blood sugar correctly, so the person starts to become insulin resistant, and then he becomes gummed up with a sugary type of coating around everything in the body, and that is diabetes type 2. And then, as I mentioned before, warning sign number 6 is you feel full after every meal. You just eat a few bites, and then you can't seem to get on with it, and you have to stop eating that meal. So because of all of these previous factors, persistent fatigue starts to set in. And this is then caused by lack of nutrients, lack of absorption of anything that means anything for your production of energy and your metabolism from working properly. So if you are suffering from any one of these symptoms or a number of them, you should probably go to your doctor and get your pancreas checked. So some of the causes of pancreatic cancer or pancreatic issues is lack of vitamin D, obesity, alcohol consumption, drugs, smoking tobacco. There might even be a genetic factor involved. But those are things that could bring on issues with the pancreas. The pancreas is very, very specifically designed to do very specific functions within the body. When it gets overloaded and it starts to become toxic, then it starts to play up, and then you could start developing tumors on the pancreas itself or in the ducts that run out of the pancreas. The other problem might also be is that when those ducts get blocked, is that those digestive enzymes start to run back into the pancreas and it starts to digest itself. So in order to prevent any kind of cancer, or even if you're approaching it from a health side and you're trying to reduce the size of tumors, vitamin D can definitely help the immune system fight back. Here's what I suggest. If you're trying to fight this cancer in conjunction with maybe some medical procedure that you're having for it, or if you're just trying to prevent getting your pancreatic cancer, is have berberine, green tea, garlic, and lots of cruciferous vegetables. Make sure that you wash your cruciferous vegetables, because you would literally be counter to what you're trying to do if you're not washing your vegetables, because then they would be full of insecticides, which are carcinogens, which means they are cancer causing. Get enough sleep, reduce stress, exercise daily, and practice intermittent fasting, even prolonged fasting if you have to. When you have pancreatic cancer, unfortunately, prolonged fasting is no longer an option, because you're just losing weight way too fast. It's not going to help doing prolonged fasting, which can help reduce cancer tumors. But it's a tightrope that one walks when you have pancreatic cancer, when you're trying to fast it and reduce the size of the tumor by fasting, and also keeping enough weight on the body to be able to fight back against the cancer. So one has to be very, very careful when it comes to pancreatic cancer. As I said at the beginning of the video, it is an exceptionally aggressive cancer, and it definitely needs to be looked at by a medical professional. But I also think that one should have a look at his diet and his lifestyle to give himself the best fighting chance if he does develop pancreatic cancer. I hope you learned something in this video, and I hope you don't have any of these signs. But if you do, go and get it checked. Doesn't mean you have to be all fearful about this. Just go and get it checked. Make sure that it's not there. If it is there, at least you would have caught it early and there won't be a problem. Good luck.